in Malawi, which has delayed the opening of public schools to slow down a surge in cholera deaths. The country's health minister, Kumbize Chiponda, on Monday said the delay would take effect in the cities of Blantyre and Lilongwe. The total number of infections has surged to over 17,000, with deaths at nearly 600. The first cases were reported in March last year, and the current outbreak is expected to be the country's worst yet. The health minister has called on authorities to tighten control measures in public spaces. The World Health Organization says 30 countries around the world reported cholera outbreaks in 2022, and that's about a third higher than in a typical year. Well, we have with us Dr. Dossou Vincent Sodjinou, an epidemiologist and the WHO AFRO cholera focal expert. He joins us live via Zoom from Dakar. Thank you so much for joining us, Doctor. Well, the UN said that 30 countries were hit by cholera outbreak as at the end of 2022. Doctor, what is the situation now on the continent, and which areas have the most critical outbreaks?
Okay, good afternoon to you and to our colleague. Yes, last year, a total of 30 countries were affected by cholera outbreak across the world. In the WHO African region, we experienced cholera outbreak in 15 countries. Preliminary data that we have show us that we reported close to 72,000 cases during the year and 1,500 cases from these 15 countries. Currently, the outbreak is still going on in 8 countries, and the most critical outbreak currently are reported in Malawi, in Cameroon, and in DR Congo.
Doctor, what kind of coordinated response do you see across the continent to help nations deal with the situation, and what do you think is needed most urgently?
Okay. Under the leadership of the regional director, Dr. Mweti Mashidizo, and the regional emergency director, Dr. Gay Salam, the Regional Office of Africa is implementing the regional framework for cholera elimination by 2030. The main interventions that are being implemented includes multi-sectoral coordination, health system strengthening, hotspot analysis, cholera elimination plan development and implementation, cross-border collaboration, and partnership strengthening. In the affected countries, we have established incident management system, and we are providing technical, logistical, and financial support to these countries to deal with the outbreak. We are also implementing preparedness, preventive intervention in at-risk countries. Last year, by example, we conducted a readiness training in 27 countries, and we trained close to 300,000 people across the country to be ready to prevent outbreaks. Our critical need now is more funding. We need more funding to support the response in the affected countries and also to continue preparing the at-risk countries to prevent and eliminate cholera in the region.
Doctor, currently now with these outbreaks that we're hearing, we heard of Malawi, Nigeria, how is the cholera outlook in Africa looking for the near future, and could things change if the weather changes?
Yes, we know that the main predisposing factor for cholera is the access to water, safe water, and adequate sanitation. Unfortunately, in the region, we have many areas where access to water, access to sanitation is still low, very low. So if there is no action on improving access to safe water, we will continue to experience cholera outbreak across the region. But as I raised it a few minutes ago, we have a regional framework for cholera elimination by 2030. Cholera is an easy preventable disease, and we know all the interventions that need to be implemented to prevent and eliminate cholera. So we will need more support, more funding to be able to implement this regional framework to support countries to deal with cholera, to strengthen health system, to empower human resources for early detection and response to cholera. And if we succeed in doing this, we will be on track for eliminating cholera in Africa by 2030.
Dr. Sodjinou, thank you so much for all that.